and welcome everyone on today's workshop on graduate applications in public health and health policy. It's one of our series on workshop on science and health policy. Let me introduce you to Project EduAccess, as those of you are already well versed about the kind of work we do, but there might be some new faces. So for that, as we know, Project EduAccess works on the access to higher education, leadership, and professional opportunities that we believe is a privilege that most of the people from marginalized communities are denied, either to cost, information, and dispositional barriers. But what is Project EduAccess? It's a modest attempt to improve inclusivity in these spaces. By removing some of these barriers from marginalized communities in the global south, we aim to improve the participation and representation of the individuals from marginalized communities in higher education and create avenues for their personal, professional, and leadership development. So, how do we do that? For that, we adopt four key interviews. Number one is mentoring, counseling, and role modeling. Number second is information, advice, and guidance. Number third is capacity building, leadership skills development. And lastly, evidence based advocacy. So now I'd like to give you an outline of how we'll proceed in the entire workshop. You already know about Project EduAccess. We'll meet our amazing panelists. They'll give you an overview. Then there will be an overview about master's program, course structure, the nomenclatures, how to choose a country, how to choose university, everything about masters that you need to know. Then it will be about PhD program. Similarly, it will be about the course structure, choosing the country, choosing the university, finding the right program, then some career prospects, general tips, and Q&A. Let's meet our amazing panelists. We have Anwesha Lahiri. She's PhD in Medical Sciences, Epidemiology, University of Cambridge. She can speak English, Hindi, and Bengali. Thank you so much, Anwesha, for joining. Then we have Kulsoom Masood. She's MSc in Public Health and Community Wellbeing, Anglia, Ruskin University, London. She can speak English, Urdu, Pashto, and Sindhi. Thank you so much, Kulsoom, for joining us. So from here, let me hand over to Kulsoom.
Perfect. Thank you so much. And hello, everyone. Assalamu alaikum, namaste, everyone. I'm really happy to be speaking here to the students who are interested in pursuing public health. My name is Kulsoom Masood. I'm currently working as a senior program development officer in public health, specifically in the mental health area of public health in an international NGO in Pakistan, Islamabad. So before going into deciding what you want to do for your bachelor's or master's, or for that case, for any degree, it's important to know that what is the degree about. Now, public health, especially after COVID-19, really became a buzzword. Like everybody was talking about public health, population health, health trends of disease. So what really is public health? And I really like WHO's definition, because it really, brings it down to the main point, that public health refers to all organized measures, as in interventions, whether public or private, means if the government takes it or any private entity takes it, to prevent disease, promote health, and prolong life among the population as a whole. What does it mean? It means that how the disease travel within that specific population, what are the attitudes and behaviors of that specific population, which gives the disease to travel within specific communities, how are people reflecting or reacting to that disease, and how as a whole health is being promoted in that community or population, whether in that specific community or a country or the whole bigger geographic area, and what measures are being taken to prolong lives. For example, if we talk about disabilities, so in that we take such measures in which people can live longer with a disability, or if, for example, if there is a certain disease, so we take or talk about or research on such measures through which people can live longer with that kind of condition. So basically, as a whole, public health is really the study and research of health as populations, but not just individuals, as in how the disease and the specific situation is reacting or behaving in a certain population. The field of public health plays a critical role in the promotion of health, prevention of disease, and empowerment of individuals to manage illness and disabilities. Public health and policy programs focus on addressing global and community health challenges through interdisciplinary approaches. For example, we can take example of COVID, how something as basic as washing hands became such a global intervention or a way of preventing yourself from getting n COVID-19, or any other, for that matter, wearing masks. Even now in Pakistan, I can speak for my country that till this day people still wear masks, and it is basically a result of COVID, because at that time people realized that we can live, or go out and walk for hours and hours just with wearing mask as well. So these are some of the behaviors and things that disease or a global phenomena can bring about. So that is basically what public health talks about and what you can study in it. Now, what is exactly can you learn in public health degree program? In a public health, and this is according to the Michigan State University, in a public health degree program, you'll learn how the conditions in the places where people live, learn, and work, grow, and play affect their health outcomes. So in public health, we also talk a lot about health outcomes, determinants. What are the factors and what is its outcome? What is happening? An event, for example, the cause A is the cause and B is the outcome. The cause was climate change. What happened? It caused COVID. Then what was the outcome of COVID? Maybe people start washing their hands. Maybe there was more isolated. Weddings became smaller. Gatherings became smaller. So what were the social outcomes of the whole thing that happened? So in public health, we talk a lot about outcomes. We talk about determinants, factors, and we really go into the grassroots level to really study the cause of that thing that has taken place, whether it could be a disease, it could be a health pattern, or anything else that is affecting the health of populations. And what are so these are some of the fields of public health that have been written here, but it's not limited to this. It really varies from country to country, what the country or the program prioritizes, but here are some of the general fields that we have written down for you. These can combine epidemiological research, policy analysis, health needs assessment, health determinants, the factors which I was talking about, social scientists to prepare professionals for improving healthcare systems and population health outcomes. Next one, please, Yamina. Thank you. So this is a general master courses overview. It is basically an amalgamation of a lot of courses that you can find online, but this is really a general overview. The good thing will be that once you have a focused topic in your mind, then you can go to that specific website and then really search the courses and topics that you would like to study. But this is just like a general collection. So core modules often include epidemiological research, like I mentioned in the slide before, to communities of health. Yamina, can you please bring this thing in the middle? I think it's, yeah, this is fine. Thank you, Yamina, sorry. Epidemiological research to communities of health, healthcare financing to service commissioning. Healthcare financing is another very important part of public health, because obviously you need funds to run a program, you need funds for an intervention. So healthcare financing also includes the health needs assessment, health technology assessment, that is called HTA. So HNA is health needs assessment, HTA is health technology assessments. These combine together that help you with budgeting the health interventions. How much money do you need to allocate for workforce or technology or research? So this is also a very important field of public health. Biostatics, health economics, global health systems. Global health systems involve all the major big think tanks, such as WHO or UNICEF, UNHCR, or all these big think tanks that work on the world health systems. Healthcare policy analysis. What are the policies that are coming about in healthcare and all that? Electives may focus on topics like maternal and child health care, infectious disease management, or health promotion. It can also include sexual and reproductive health, antenatal care, and all these small components of the bigger umbrella that is the public health. And it's also up to you how you shape your whole degree as per your elective. So then there are some core modules in which you will be automatically enrolled, and they are always there. They are the essence of the degree. And then you are given the choices in the electives, and you can form, for example, in my case, I was interested in antenatal care or sexual and reproductive health care. So the elective that I chose chose, or the research topic which I chose, was all about facilitators and barriers to accessing antenatal care in Pakistan by Pashtun women. So I'm from a Pashtun community, from KPK Peshawar. So this is why my research was, based on my community. So that is how you can also form your concentration or specialization while you are pursuing your master's. And there's examples of some universities here. For example, in Harvard University, MPH offers courses in health policy modeling and leadership, while the London School of Hygiene and Tropical Medicine provides specialization in global mental health and health financing. Now, global mental health also became a really big phenomena, especially after COVID-19, because along with the symptoms of COVID-19, almost every individual was also talking about mental health and how not physically but mentally they are not feeling that well. Even after I myself got COVID 3 times. So, and even when I was done, when I was feeling all healthy physically, but mentally there's always something left. So it became a really, and it's still a very, very important component, especially mental health for women and children and other, genders, because usually in a pandemic, these are the most vulnerable populations who are mostly left, helpless. And the Anglia Ruskin University, from which I did my MSc in Public Health, ARU, offers public health and community well-being. This is my degree, with courses such as essential issues in public health and practice, statistics and epidemiology, community public health, evaluation, strategic leadership management and commissioning in public health, and the last postgraduate research project, which was my thesis, or in some university they call it final year project or capstone project, or whatever. In our one, it was called the systematic review. So I did a systematic review of all the facilitators and barriers to accessing antenatal care, and essential issues in public health involved, because I studied in the UK, so it was mostly around what was happening in the UK. So I found out that one of the major leading health issue in UK was mental health of women. There's a quick and a big onset of Alzheimer's in women in the UK, and then all of it was connected to the family structure there, the social determinants of health and everything, the factors and the outcomes, and why is it a problem over there. So such the place where you study or the country you study also affects the contents of your master's course as well. So while you're choosing the course, you should keep that in mind also. And then in statistics and epidemiology, we studied researching on Excel, SPSS, using formulas, all everything statistical, all the formulas and all the P test and the other, I'm forgetting the names of those tests, but that you use for example, confidence interval when you're trying to find out, the margin of error in a research, +5, -5, along those lines. There was a bit of a calculus in it as well. So statistics and epidemiology was more about these kind of mathematical aspect of public health over there, because obviously you use it in sampling and all that. And then community public health and evaluation was all about health needs assessment. What are the needs of this certain intervention? There were certain tools that we used for appraising our papers, and certain tools that you can find out in order to come to an outcome, to arrive at an outcome. So those kind of tools were used there. Strategic leadership management and commission is all about project management. So for people, for example, I was interested in project management eventually, coming to this my current position. So this is why I was more interested in this one. It is all about what career you go into, how do you manage a project. We were supposed to develop a proposal in this course, so it also taught us what are the important components of a proposal, what does your team look like, what is your budgeting look like, and how is the intervention, where is the evidence. So evidence based public health is also one EBPH, we call it EBPH, where you collect the evidence and then you come to the intervention and then the outcomes of the intervention. So many programs conclude with a research-based thesis, systematic review, practicum, capstone project addressing or real-world public health issues. So yeah, that's what I already mentioned above. Yamina, you can move to the next one. Okay, so nomenclature of master's degree, there are various names. Again, it depends on each university, each country, each degree. Public health programs are typically titled as Masters of Public Health, which is MPH, or Masters of Science in Public Health, MSc, PH, or which I have done, or Masters of Global Health / Public Health, which is MSGH. And most of them vary. So some of the core modules stay the same. And then, for example, when there is MPH and if it is MSCPH, then some of the courses are changed over there, or there is a little bit of, in the electives part of it, some of the options are changed. So that is really up to you. If you look as per your own interest, which course you want to choose, where you want to go, and then you choose. And honestly, like in my experience, like I did my masters in public health in 2022, so it's almost 2 years now. In October they were 2 years, and I really don't see a difference whether if one degree is better than the other. It's really about your experience. So if you are, really interested in MPH, or you're very interested in the courses that MSc has to offer or global public health has to offer, and you have already your objectives set in mind, and you know you what you want to do about it, then there is really no difference with what happened. Every course can give you what you want. It's just about your experience and the electives that you are interested in. Health policy degrees may be called MSc Health Policy, Masters of Public Health Policy, or Masters of Science and Health Policy and Management. So this has to do more on the policy and lawmaking, that what is an outcome of a policy for certain health policies over there, then how is it affecting the environment, how is it affecting the population, and more along the policy making. And you can be with the you can be making policies with the government or with the non-government organizations, maybe with WHO, or maybe government of India, government of Pakistan. So it all varies. Next slide please, Yamina. Okay, master's courses, choosing the country. Again, choosing the country is a again very important and major decision, because you are going to be living. You're actually, if unless it's a distance learning, which is a separate thing, then you do it from your home. But if you're traveling there, you will be living there. So it's important to do a bit of a research about your country. All of this is all based on your own research. So, for example, USA is known for comprehensive MPH programs such as John Hopkins Bloomberg School of Public Health. One of my friends got her degree from here, and I think, in my personal opinion, if you have a medicine background, I think USA is a really good option, because USA medicine public health is really good. Like their doctors are really good. Then UK excels in global health and policy research with institutions like the London School of Hygiene and Tropical Medicine and University of Oxford, of course. Then you again, I myself, I got my degree from the UK. It's really good when it comes to research or program management on and more on the team management and leadership side and discussions and all that way. So UK is also a really good option, and it has really good schools of public health as well. Canada prioritizes community focused and indigenous health studies, example University of Toronto. So even though these things are written, these are still very general. So it doesn't mean that if Canada prioritizes this, it doesn't mean that UK doesn't or USA doesn't. Public health in itself, it involves the community focused interventions. So in any case, you will be studying community focused interventions, that things that come from the community, because public health is all about community and population health. Australia offers strong environmental health and rural healthcare research opportunities, such as the University of Melbourne. Okay, so some of the things that, from my experience, that I'm talking, choosing the country also depends on general living conditions. For example, what is the standard of life over there? What if, these days we know that in Europe there is a great recession and economic depression, and those things are going on. I remember that when I went there in 2021, and that was the time when employment opportunities were getting a little thin, and international students were a bit under a cloud of suspicion whether we'll stay or go back, or what will happen there. So you really have to study the country for yourself. What do you feel about the country? How can you will you be able to settle there? And a lot of information is available online. Also, it's really good to get in touch with the country director or the country supervisor. Every country has their own country director or manager, and you can get in touch with them, and you can get information on the environmental generally about the country. And then it's good to stay in touch with the news as well. Then standard of life, graduate / settlement visa route policy. Now this is really important, because if a lot of students, including me, we wanted to go for PSW. In UK, they offer PSW, which is post study work visa, which is 2 years of work visa. If you do a master's from the UK, they give you a 2 years of work visa. Obviously, you have to pay for it. It's not like it's not given to you, you have to pay, but you have that option only because you have done a master's there. So in that, now it is up to you whether you want to take this graduate route. Like for some people take 2 years PSW, and while that time they can work there also. You are allowed to work for the normal 40 working hours, and during that time, then you try to find a sponsored job there as well. Before this, right after graduation, the students had to find a sponsored job. But in UK now, they have this policy that right after your graduation, for 2 years, you can apply for a PSW, and after that, you still will have to look for a sponsored job for settlement or ILR, or that is. So these are some of the decisions that also help you in choosing the country. Now, I don't know what, maybe for Canada, I think in 3 years you can get their nationality, and for other universities, but it depends on your research. Then work hours permit. So, for example, I was allowed to work during my course of study, I was allowed to work for 20 hours. So now, maybe in some countries you can work full time. I was only allowed to work part time. So I did, and it helped me with my traveling and other things, other expenses that I wanted to do there and stuff. So these are also some important things to look into. Now, length of course, study priority area. Length of course matters as well. For example, when I was looking at all these courses, I looked into Australia, USA, UK. So in UK, my program was 13 months. So within almost 1 yearish, I was getting my master's degree, which was working perfectly for me, because after a year, I had this opportunity back in Pakistan. So it worked well with my timeline. Now it is up to you whether some countries offer 1.5 years of masters. Some in Pakistan, there's a management degree MBA, which is also 1.5 years, and then there's a degree which is 2 years as well. So it is up to you really how much length of the course you want. From some places you're also exempted. For example, if you have a BS in the similar field, for example, if it is a public health, for just stating it as an example, if it is a public health degree and you already have a BS in it and you have studied some courses, you might be exempted from some courses in your masters. So then it depends on what kind of a background you have. Yes, language and culture as well. So now again, this is all about your own ease, because cultural shock is a real thing, especially if you have never traveled abroad or lived on your own, because now you will also be living on your own. You'll be doing your own dishes and clothes and studying as well. And you might be working part time also. So think about all these important culture and language barriers. For example, coming to UK, whether you can converse well in English or not, and a lot of other cultural things. So these also play a very important part in choosing the country. Next one, Yamna. Thank you. Okay, choosing the university now, another important thing. So now program specialization. I know that all the universities offer these programs, but some universities have them as their forte. For example, London School of Economics, LSE. Now it is good for public health economics. It is known for the economical side of the public health, like the one we talked about earlier. It is known for it. Now there's even University of Oxford. There's another university, Oxford Brookes, sorry, University Oxford Brookes and Queen Margaret University. These are some of the universities. While I was applying, I researched that they're good for public health. So this is how you can know that these courses are offered in all these universities, but some universities specialize in them. Some of them have produced some really good research in them. When I was choosing my own university, I went on my university ARU website and I saw that it had received the academic excellence award as well for this department. So this is how I made my decision, that okay, it has some standing in public health, it has a separate school of public health. So I decided to apply for this university. So this is how you identify the university that specialize in your field of interest, and then you can go for it. So it helps with choosing the university. Length of course, like I mentioned, some universities offer 13 months, some offers 1.5, others can offer 2 years. So it's really up to you. Faculty expertise. I got in touch with my faculties, I think 2 to 3 months before my course started. Just right after I got my acceptance, I emailed my professor because I knew about it. I've searched for them on LinkedIn, and I knew what professor had what specialty, and I started my conversations with them, and that also helped me in forming my thesis statement, my thesis topic, because I chose that course was 13 months, and 13 months just go away in blink of an eye. It's really quick. So this is why I had the discussions with them already. I made my relation with them already, and really helped me while I was there. They knew me, and it was really welcoming, and it helped me in the classes as well. And also they can then become your thesis advisor also. It also helps with choosing the thesis advisor. Then QS ranking, yes, this is important. All this data is available on Google. You can check the ranking of your university, and it also helps in choosing the university. However, it in my experience, it does not have effect on employment. It doesn't like really I'm just speaking from my experience of, like, after receiving my masters, and this is my second year after masters. It did not really matter where I got, whether it was a 40th rank or the first rank or the 10th rank. I got job offers in the UK, I got job offer in Bangkok, and I got it in Pakistan as well. So it really is how you present yourself, or what are your grades, what was your thesis, how do what do you make out of your degree is what really matters. Again, facilities, check if the university offers good research facilities where you can sit and do some innovative work, labs and resources to support your academic and professional growth. Check the faculty, research center, alumni bodies, and placement opportunities. Now, placement opportunities is something that is really, really important. I also looked for the job fairs that my university had previously done, and that helped me in identifying that, okay, yeah, this university is good, because a lot of big organizations in the UK are coming to job fairs over here. So that is how I also knew that, okay, my university or any other university is good. So job fairs also really help with employment. And not just this, you can even go to job fairs in other universities as well, or even other centers. But it's good to be on on top of these things. Work experience, look for programs that offer internships or research or collaboration. That's really good. For example, in my when I worked, I was doing internship first at a hospital, and then I did an internship at intergenerational healthcare system, and then we were working with children and elderly, and it was a really good experience, and part of my master's program. So it also helped me gain real time experience of what is really happening on ground and what we are studying. And university location and accommodation, obviously, if you're planning on living there, so you have to look what kind of accommodation there is, whether you like to live in a very populated and noisy area, or you want it quiet. So there's quite a number of opportunities available there. I was living in a dorm because I wanted to socialize with my classmates or other people living there or going to the university. Was some of my friends were living in private accommodations, they were renting houses. So that, and all of this is again available online. There are applications, there are apps that you can use while sitting in your own country. You can book that, all of that over there. But it's good to be in touch with the country or area manager of your own country, and they can also help you with these things. Next one, Yamina. How to pick your specialization. Choosing your specialization is a major and a very personal decision that comes entirely from your own interests and experiences. For example, I love to discuss things. I discussed it with a lot of people, what is good, what is bad, but at the end of the day, you know what you can do, what you are interested in, and what you're not interested in. Trust me, maybe in bachelor's you can still take some risk, but in masters and even in PhD, maybe Anwesha can tell better, but it's good to go with the things that you have already focused on and you're already interested in, because that eventually shapes your thesis, that eventually shapes a path for you way forward. So specialization may be a continuation of your previous degree. For example, if somebody has already done a BSc in public health or MSc in public health, so they can go for masters in public health or a PhD in public health. Based on work experience, for example, you worked in a hospital in a specific department, conducted research in a specific field or health medicine. For example, this applies to me. I did my bachelor's in social development and policy. Now this is a very vast, it was all about social and societal theories, and we studied all these social theories, and then we studied some health policies and stuff. But it was not like a concise degree. There were a lot of components of everything in it. But after that, because I got a job in Indus Hospital and Health Network, and I worked in a hospital for 1.5 years in the training and learning department. We did a lot of research on family planning and sexual and reproductive health, and based on my experience I applied for my degree. So if for my, there's always when you open the website, they also tell you that what do they accept. So there are some grades, there's some experiences. Maybe in shivning they accept certain hours of experience. In ARU, when I was applying, it was written that you either need to have a relevant BSc degree or at least 1 year of relevant work experience. So because I had 1 year of relevant work experience, 1.5 year actually, so I applied for it and it was accepted. So sometimes your work experience, so it's not important that, like, I'm not from a clinical background, I'm not a doctor, I'm not from a clinical or medicine background, but because I had a similar work experience in a similar field, so I got accepted here. So public health is not just limited to doctors or clinical backgrounds or just the medical work. It can also be social work, it could be project management. It's just that you need to have that focus, what you want to do with it, and the relevant work experience as well. Additional adding qualification for a specific position. Yes, some positions also ask you that, we will be choosing you if you have done a master's or if you have done a PhD. Some people can also do it just for, getting that degree for your position that you are interested in. Inspired by a global event such as, if in COVID, mental health became a really important word. Mental health and psychosocial support, climate change, all these became really important buzzwords and everybody wanted to study it. So you might be inspired by these and you would like to go in, but again, you need to have a focus, a research focus for it. Then identification of a specific health issue in your home country. Example, health patterns or disease in your community, social stigma, issues such as SR, HR, FGM, MHPSS. For example, in Pakistan, there's a Bohra community, and FGM, female genital mutilation, is a really huge issue. I'm not saying it's just there, it's actually happening everywhere in small levels, but then in some communities it is happening on a big number. And this is how, a person can get inspired by it, that okay, my community is going through this problem, maybe I can, do an intervention or form a research around it or something like that. So you can also pursue this degree based on your own community experiences or country experiences or all the other things that are mentioned above. So these are some of the factors based on which an individual can choose their specialization. Next one, Yamina. Okay, so now I will hand it over to Anwesha and she'll be talking about the PhD courses. Thank you so much, everyone. I hope this was helpful.
Yeah, thank you so much, Kulsoom. Okay, right. So you've heard all about masters in public health applications from Kulsoom. Let's dive into if you want to take your career further in academia and do a PhD. We'll talk about the structure, applications, and thesis in the overview section here. So length of a PhD typically can be from 3 to 4 years. If you're looking at a shorter PhD program, to 5 to 7 years. If you're looking at a longer PhD program, UK programs are typically shorter in length, and US-based programs are typically much longer. It's very similar in Canada. I can't speak a lot for other countries, but it's usually around these ranges, and you probably should figure what suits you best when you're considering PhD applications. In terms of coursework, now this also varies from country to country. Typically, you could expect coursework in research methods, biostatistics, basic principles of epidemiology, policy evaluation, health economics, some informatics, again, based on what exactly you're doing. You can also expect some multidisciplinary coursework, depending on if you're working in geospatial analysis of health. You might have to do some courses from a geography department, for instance, or you might have some sociology courses if you're looking at social determinants of health, etc. Now, in the US, typically, what happens is the coursework itself is around 1 to 1.5 years, and it's typically mandatory in the US to do that. In the UK, coursework is optional, and that's typically because they expect you to be trained before you come into the PhD. So in some cases, for UK degrees, a master's may be a prerequisite because they don't have an obligation on you to do coursework. So either you would already have those courses in your previous master's or bachelor's or something like that, or you would have enough work experience to justify that you don't need to take on those additional courses. That's what mainly happens. Okay, now let's talk about the application process itself. So in a PhD, you absolutely need a supervisor, right? So finding a supervisor with expertise in your specific research field is absolutely critical, and that needs to start early. Say, again, finding a supervisor or approaching a supervisor depends on university to university. So you should check wherever you're applying what their policy is on contacting supervisors. Now, typically in the US, you can decide your supervisor after you've been enrolled. So you can work with a few people and then arrive at a decision in some schools. So you don't need to specify one supervisor in your US PhD application. You can specify multiple, and you can speak to multiple people. Even if you don't speak to them in advance, it is still fine. However, in a shorter PhD program like in the UK, it is absolutely critical that you do speak with the supervisor and discuss your project with them, because they need to be able to support the research that you're undertaking. Their lab or their research group needs to have access to what you're proposing that you would do. So you definitely should be speaking with them. The other way to contact a supervisor is through advertised PhD projects, and that can be anywhere. It can be in the US, UK, Europe. If you see a research that's already been advertised with a specific group and you want to apply to that very specific PhD, of course, go ahead, speak with them, and then work with them on the proposal. Now, then the other thing you have to be mindful of are application requirements. So please check what the documents needed for your application are. Typically, these would be personal statements, some very specific essays. These essays are quite typical in the US public health applications or public health PhD applications. The UK might also ask you to do very specific essays based on some funding that you're looking at. The US applications sometimes have something called a diversity statement. You may also be asked to, of course, do a statement of purpose, which can be different from a personal statement. And you might need to submit a research proposal in most cases for a PhD application. Then comes the interview. So if your application is shortlisted, most doctoral programs will provide an interview or will involve an interview. That would ask you to come in for one. And some programs may involve an additional interview based on what funding you're applying to. Now, that brings us to funding. PhD programs, say in the US and most places, come with their own funding. So if you're given an admit, that means that you've been given an admit with full funding. However, some universities don't do that. Some universities will give you an admit, and then there would be a separate round for funding. And this includes most universities in the UK. So even after you receive your admit, you would be in a funding competition, and you may get funding through external fellowships or fellowships within the university, government fellowships, whether that is in your own country or in UK institutions. So say you have a lot of Commonwealth PhD fellowships, right, which are kind of a collaboration with UK universities and a Commonwealth country. So that could be a source of funding your PhD. There could be university-based fellowships. For instance, University of Cambridge and Oxford have their own internal fellowships. Departments have their own internal fellowships. If you're doing a public health PhD with the Medical Research Council or UKRI, they would have their own fellowships. So just the fact that UK PhDs don't come automatically with fellowships doesn't mean that it doesn't. I mean, UK PhDs are not funded. They, of course, are. It's just a second cycle or a second round that caters to the funding bit of the PhD. Great. So now what would you typically do in a thesis? We'll get into this in a little more detail in a few slides, but very broadly, your thesis would essentially be multidisciplinary, and the broad aim would be to tackle a range of complex, large-scale population health challenges. And you would integrate different aspects from different disciplines across biology, environment, sociology, etc. Topics may range, again, from social determinants of health, healthcare delivery systems, behavioral health interventions, pandemics, etc., just to name a few. Yamina, can we move on, please? Yeah. And the other component that you may have in a public health PhD is a bit of field-based research. So remember, when you are conducting any sort of research in public health, it's not a lab-based PhD. It's not a PhD that involves experiments, really. So you need to have access to some sort of data, right? And it would be a computational PhD, more or less. So say you're researching multiple micronutrient deficiencies or interventions to improve multiple micronutrient deficiencies in South Asia, and you would like to work with tribal populations in South Asia. So you select who you want to work with, and then you may have to collect data from this population. So you have to obviously understand what risk factors you want to study or what interventions you want to study for multiple micronutrient deficiencies. You may have to arrange for phlebotomists to collect blood, and then you may have to do some biochemistry analysis on that blood to get that data. So it may involve some field-based research and a bit of lab-based research, but mostly it is basically analyzing the data that you see. And you obviously have to explore some collaborations. Either your department would already have existing collaborations or existing access to data. You may not have to do any field-based research if you already have access to a large data set, which is what I've seen a lot in, say, big universities in the US and UK. You don't often have to undertake your own data collection at all, and they already have access to data. But these are some things to look for when you're choosing your research groups. Let's move on, Yamina. Yeah, great. So choosing the country, in terms of PhD programs, I have applied to the US and the UK, so I will only be able to personally speak about these two sorts of countries. But then there's a list of several institutions down here, which you can, again, look at your convenience. This will be uploaded to YouTube, so you will have access to this material later on. So if you want very extensive training, if you want a longer PhD, where you obviously have broader access to collaborations, to exploring a wide range of research topics, to doing internships with companies or other academic institutions, USA would be a better option to pursue a PhD, honestly. If you do not want that, if you would rather, if you already think that you're highly trained and you can finish or you can commit to a very focused PhD in 3 to 4 years, then UK might be a better option for you. But obviously, just the duration and just the extent of academic training are not the only factors in choosing a country. Think about the research group, think about who you want to work with, think about, all of the things that Kulsoom mentioned as well. So this is a very big personal decision. It's a big commitment for at least 4 to 7 years. So think about a lot of factors before choosing your institutions and countries. Yeah, let's move on. Yamina. Great. Now, how would you choose a program? Firstly, research focus. So select a university with faculty expertise and research projects that actually align with your academic interests. Second, think about a good supervisor. Look for programs with strong faculty guidance and mentorship. You already may know the leaders in your field from your own research or conferences or lectures you've attended or papers you've read. So reach out to the people you actually want to work with. Look for funding and scholarship options. Of course, it's very difficult to self-fund a PhD, so investigate what funding options are available at the university of your choice. When you talk to a supervisor, if they've agreed to take you on, also ask them about the funding options that are available. Discuss that with them, because without that, you won't be able to join their group, right? And EduAccess does a bunch of other workshops specifically focused on different sorts of funding if you want to have a more detailed idea of what external fellowships are available, especially in the UK context. In the US context, it's slightly easier because or if you get an admit, it will always come with funding. Right. And research facilities, of course, ensure that the university has research labs and access to the data that you would require for your research focus. So this kind of goes back to the research question I was talking about. If you wanted to study anything, if you say wanted to study maternal and child health somewhere, you would need access to a data set that's relevant in maternal and child health. If your university doesn't do any work in that area, then it's probably not a good fit for you. So make sure that your passion is at the center when you choose a program. Yeah, okay. Now, how would you choose your specialization? So let's start. So we'll be a bit investigative and self-introspective here. In terms of what you want to do, or what specific niche you want to specialize on, let's start with 2 questions. The first being, what are you passionate about? And how do you know that? You would typically know that from your undergraduate and graduate training, research and work experience, just life experience in general, any volunteering experience you might have had. Yamina, can you slow down a little bit, if that's okay? Yeah, thank you. So all of that would inform what you're passionate about, what global challenge you want to solve, or what local challenge you want to solve in public health, right? Now, when you know what you're passionate about, next question you ask yourself is, why would you want to do a PhD? And that's typically because you would want a deeper understanding in your area of interest. So you would, in a PhD, you would expect to get comprehensive understanding of scientific methods in your area. You would be creating knowledge, and you would also learn how to interpret knowledge that already exists very effectively, and then implement that knowledge in practical settings, right? So now, why do you want to get this expertise? You want to get this expertise because they are somehow tied to your career goals. So what values do you prioritize? Do you want to just build knowledge? Do you want some autonomy? Do you want to create your own organization? Do you want stability? Do you want to work with pre-existing systems of health governance, for instance? So all of these are questions you need to ask yourself and think about what path you're going to take beyond this. So there can be two paths. One is an academic path and the other is an industry path. So if you're going on this academic path, then you typically would look at postdoc, lectureships, fellowships, look at teaching positions, and then how do you decide what benefits you into getting those positions? So what is your research focus in the long term? Think about 5 years, 10 years from now, what would be the research focus of your own group or your own lab, and what is the training that you need to make that happen? So for instance, if you want to do maternal and child health, if that's your research specialty, then what PhD training do you need to build towards that? Now, maternal and child health might be a big research area, so you might want to just focus on, oh, I'm going to do child undernutrition in my PhD. I'm going to see interventions to tackle child undernutrition in South Asia. Maybe that's going to be my focus. And then I'll build on that in postdocs and lectureships. And then I'll have my own lab, which focuses on this one area. So that is a way to kind of figure out why you are passionate about a specific specialization and then what you need to do in a PhD. The second thing you might want to do is go into industry, right? The private or the public sector. Now, there's a wide variety of things to choose from here. Yamina, you can just move on with it. Yeah. So you could become a policymaker, you could be in consulting, you could, sorry, Yamina, can you go back? Yeah. You could be in health governance. You could be the CEO of a multinational company or an organization that influences public health. You could be an entrepreneur, start your own firm. You could work with public health agencies, both private and public. You could become a community health activist. You could lead an NGO. You could work with existing multinational or national NGOs or local NGOs for that matter. So think about what skill sets would you need for that job that you desire. So if you want to go into policymaking, maybe your PhD ideally should focus on health policies. If you want to become a policy analyst, maybe that's the skill that you want to show that you've kind of honed on in your PhD. So if you want to understand more about health governance, maybe you want to look at a PhD that actually works with the government on government health policies, on implementation or challenges in last mile health delivery. Maybe you want to learn how health systems work to make you well suited for a job like that. So similarly, just look at what you kind of want to do 5 years, 10 years, 20 years down the line, and tie your goals or tie your PhD goals to that dream, and then pick your specialization. Because when you write your personal statement, this is something you also have to explain there anyway, because you do have to talk about your career goals. So yeah, moving on. Now, in a PhD in public health, what would you be typically researching? So, PhD in public health or PhD in population health can be very broad, and their key focus is just to tackle global health issues using a multidisciplinary approach. So there are many examples, and you've heard multiple versions of this throughout this talk already. This is just to say, honestly, do your research, look at the university, look at what they mean when they say public health, right? Say, for example, Johns Hopkins has 4 PhD specializations when you look at their Bloomberg School of Public Health PhD courses. So one is in global disease and epidemiology, one is in health systems, one is in human nutrition, one is in social behavioral interventions. So go into each of these programs, look at what they desire, who are the faculty on these programs, and what do they work on? Does this match with your interest? it's ideal to do this sort of research for each university instead of making a blanket application because it's so broad. If you don't know what a university specializes in and what even sub-disciplines within a department specialize in, then you wouldn't know what exact PhD you're applying to. The image here is from Cambridge Public Health, and there's a link down there to their website as well. They focus on these 5 verticals. And even within these 5 verticals, I can tell you there are so many different things going on, so many different faculty specializing in different areas of public health, of epidemiology. And everything may not be just about interventions or healthcare delivery or risk factors. There's a multitude of sub areas of focus. So this is what the typical field looks like. So remember to find your right fit, basically. And it can be overwhelming. It can take a bit of time, but then you know what you exactly are signing up for. And that increases your chances of success. Right. So how to find the right program? So obviously, maybe you know the university that you're interested in already. So find that university or department, or maybe you know the research group that you want to work with. And you typically would have a sense of all of these or sense of leaders in your field from research papers you've read, conferences you've been to, or lectures you've attended, or just people based on people who you've worked with before. So if you already know all of these things, please check their website, faculty profiles, application deadlines, eligibility criteria, what kind of funding they provide, all of that. And these are just some examples as links to websites for some institutions. If you are new to this area and if you don't know how to navigate this, again, these are just some example links, but please, there are so many institutions that you can look at beyond the 4 or 5 that's mentioned here. One thing to highlight about the US is for US PhD and masters as well in public health, applications often have a central system called SOFAS. You have to make an account in SOFAS, and you would find like hundreds of universities who list their courses through this central application system. It's actually very convenient because you don't need to keep on filling in your personal details over and over again. The only new things you require when you make a new application would be different essays and statements and reference letters, really. So it's a very useful system to navigate. And the only way you can apply to certain US universities would be through SOFAS because they have made this centralized. Right, let's go ahead. Okay, so now for a PhD, we've talked about the fact that we need to contact a prospective supervisor. I will go through this very rapidly because EduAccess, again, has done multiple workshops on just each of these things that I'm going to talk about next. So very rapidly, avoid sending generic or mass emails, write very concise but professional messages tailored to each faculty you're reaching out to. Just don't copy paste messages really or emails, and highlight your interest in their work. Include very specific questions. Appreciate that. Of course, ensure your email is free from typos. Just an example, you could introduce yourself quickly in the beginning, mention why you're contacting them. Just say, I am X, currently a postgraduate student in specify your discipline, your university, and then tell them that you would greatly appreciate an opportunity to briefly speak with them about their research and what program, right? And what department, what specific thing, at what university, of course. Then go into telling them why you're contacting them more specifically. So in the first line, they have an idea of who you are, and they know if they're interested to read beyond further. And then tell them how you've read their research. Please do read their research and tell them how your interests connect with their research. Have you done something similar before? And things like that. And talk about how your skills also align with that research group. This is also a good time to attach a CV when you're contacting them so that they have more information about you, and end the email or a cover letter, whatever, with requesting a meeting, because you do have to, especially in the context of the UK, you do have to meet them to kind of get their agreement on what research you're going to do. So an initial meeting would obviously give you more insight into their group, what kind of work they're doing, collaborations, what are your possibilities, discuss your research proposal with them, ask for additional readings, all sorts of things like that. Right, let's move on. Okay, so what next? Basically assess your qualifications. for a postgraduate degree. So look at what they need, what are the eligibility criteria, your GPA grades, what tests you need to give. A lot of universities in the US will, of course, require GRE, irrespective of the country. Most places will require some sort of English language testing. PhDs might require you to have some research experience. What is the relevant coursework needed? So transcripts, etc. When you identify the relevant coursework, you can also identify whether or not you need to do a master's before a PhD in the first place. Some places also would kind of make your chances stronger if you have conferences or publications, of course, and then you would need letters of recommendation. And the other thing that is applicable in the US is, especially if you're coming from South Asia, you might need to convert your transcripts into the US grading system. And then there are agencies that does that. And there are accredited agencies whose conversion the US system or US universities would accept. So all of these needs to be kind of on your checklist and assess your qualifications and eligibility for a degree. So, and then of course, prepare your CV, conduct some informational interviews, just, find grad students, postdocs, faculty or professionals who are in your field, who do what interests you, and just talk to them very candidly about their journey, their path, and see if you can, adapt some of what they did to kind of customize your PhD journey. Yamina, can we move on to the next bullet point? Yeah. So ask about their work, their career paths, and that might help you make your decisions as well. And if you have very diverse interests, that's fine. Just don't be afraid to cast a wider net. Another very key thing is that this is a very long journey. It can be overwhelming. Don't be afraid to build your own networks of support. Find friends, peers, seniors, students who can, give you that support, not just emotionally, but also, help you review your application materials and things like that, who can just brainstorm with you, share your research interests, and just give you advice and the support that you need throughout this time. That's fairly, that helps a lot in this journey. It's quite harrowing otherwise. Okay. Let's do a very quick guide to a personal statement. Again, EduAccess has done workshops before. You can, for more detailed advice, you can look at the YouTube channel. Start early with your personal statements or statements of purpose. Demonstrate that you've considered the graduate program very seriously. And when you are summarizing your research experiences or academic experiences, explain how they're relevant to the course, especially when you talk about any sort of research project, etc., or any experience that has shaped you. Follow the STAR approach, which is situation, task, action, and result. So basically, in this approach, you describe a situation or a project. Then second, move on to what task were you assigned or what was your role. What action did you take and what did you achieve through that? So if you kind of follow this thread of argument, it's very convincing. It exactly tells your assessors how you emerged from that one particular project. How did you what did you learn and how have you improved or what skills do you have because of working in a single project? And the UK government actually has some very nice examples, which I've linked here, if you want to look at how the STAR method of basically telling a story about yourself works. So write concise summaries and stories that demonstrate your strengths. Of course, highlight your strengths, but always tie in the strengths to what's needed for your program. Again, this is rehashing of what I just said anyway. Talk about what the main project goals and big picture questions were, then what was your role, what did you accomplish? So this is about you. So don't just talk about the project or the group effort. Talk about your experience and your growth. If you have weaknesses in your resume, for example, if there's been a drop in your GPA, if you have had weak test scores, don't be discouraged by that, but think about how you would address that in a positive light. So think about how you overcame obstacles and persisted, and then you did better or something, right? Or maybe you took additional research training. What did you learn from the challenges? How did you grow from the failures? So these would be if you have weaknesses, and no one is perfect. We all have weaknesses in our careers. So this is a way of just putting the weaknesses out there in a positive light. And finally, of course, explain your commitment to research, and don't just assert your commitment. give examples. How were you committed? Did you work for long hours? Again, what their challenges? What did you do to overcome them? Were you resilient in pursuing the problems, etc., or research questions, etc.? Yeah, let's go on, Yamina. Yeah, and also, of course, please make sure that you get it reviewed by a peer or a mentor. Right. I think this is kind of, we're gearing towards the end now. Funding your PhD, US PhDs, again, they would come with funding. For UK PhDs, please look at external funding. Be mindful of the funding deadlines. We wouldn't have time to cover different sources of funding here, but please look at other videos that EduAccess has done to learn more about external scholarships available. Right. In terms of funding your PhD, okay, right. So funding your PhD is, we could probably wrap it there and move on to career prospects. So we've talked about career prospects a bit while generally talking through the slides. So you know that you have a wide variety of options here: public health organizations, humanitarian and developmental organizations, policy-making bodies, research institutions, international agencies, etc. And you could be consultants, analysts, researchers, you could be public health trainers, program managers, and you have a wide variety of employers in the field as well. So huge opportunities, of course. Let's move on, Yamina. Right, quickly, general tips, and then we open this up for questions. So one thing we wanted to share is that please always seek out research experiences and internships. They always help you in preparing for a wide range of options. At any stage in your career, it's good to kind of seek those out. Try to work for or opt for work or research experiences that are kind of related to each other or related to what you would like to apply for in your PhD or your master's, if that's something that's relevant for a master's application that you're looking at. For graduate applications, remember, whatever you're applying to, master's or a PhD, your interests still need to be very specific. So narrow down your research interests and look at what department, what faculty you want to apply to very specifically. Don't be vague in any of your application documents. Think about, if you're pursuing a master's, that is, think about a master's thesis topic that you can draw from your previous work experience and then build upon it in the future. So there's always good to have some sort of a connection in your stories when you're building your profile, or some sort of a common thread in your experiences can help you write that story. Write a general detailed essay containing all of your previous work, be it personal or professional areas, interests, and plans for the future, and use that master essay as a supplement for graduate applications for other universities. And that's very helpful. Always have a master document and then customize it for different applications. And finally, obviously make a list of important dates and deadlines and set reminders if there's a lot on your plate. So yeah, that was a long session, but I hope we've covered quite a few aspects. Yamina, should we?
Yeah, thank you so
up?
much. I think it was really amazing. You covered both of you covered almost everything. It was very extensive. So we can start directly with Q&As. Anyone, you can unmute yourself, Atul.
Hi, so I'm Atul, and I'm currently working in public health sector for almost 8 years, and I plan to apply for a PhD in global health, focusing on health systems strengthening. But my concern is I'm a little worried about the funding, and because I'm focusing on the US primarily, given the fact that most of the universities, application, as you said, comes with the funding. But there is a big chaos right now in the field of public health that since Donald Trump has come, he's going to slash out a lot of global health fundings. I just want to, that's my concern, that, if PhDs are going to be impacted by that, if you know of anything of that sort happening in the US, it'll be really helpful to, make some plans according to that. Thanks.
See, there are, there are always various either global events or geopolitical events that affect funding. And this time it may be the government's policies, which I don't know to what extent it would affect public health funding in the UK at this, US at this stage, but I don't think that should discourage you from applying, honestly. If you apply, you will, I'm sure you have your list of universities where you want to apply to. And if they give you an admit to a PhD, it would still be with full funding. I don't think they have changed their policy in a manner that, oh, we are still going to give you an admit, but you have to figure out your own funding. So I don't think that has happened yet, at least. And I mean, otherwise, I don't know if universities plan to cut their funding for global health or public health PhDs. I think it's a very important field, and there is a lot of just interest in research in this area. So it's unlikely that funding would be slashed to a huge degree. Don't be discouraged by a hypothetical government policy or probable government policy, I would say. Because there's always something. I mean, we honestly thought that, we wouldn't, it would be so hard to get in during COVID, and we won't get funding because it's COVID, and all the funds have been redirected to, actual like ground level staff and people who are primary healthcare workers and things like that. But I started my PhD during COVID, and I did get funding for that. I did feel discouraged while applying, but there's no harm in applying, and you never know what happens. So yeah.
Thank you. Thank you so much.
Thank you so much, Anwesha. We have another question in the chat. I would like to read, then both of you, anyone would like to answer. Thank you so much for wonderful session. My training is in sociology. The question is from Anamika, and she says, my training is in sociology. Have completed my master's, and I'm interested in doing a PhD in public health. My area of is interdisciplinary, and I would fit in sociology, public health, social policy, and gender studies. How do I choose a department since my research fits equally in different disciplines? And I do not have much quantitative training nor clinical medical background. I have experience in working with non-profits. While I am clear about my broad areas of interests, I am unsure about methodology I should approach my research with. For example, the methods and methodologies I have learned in sociology, it's not so solution oriented, and what are meant to understand theories, issues in a more nuanced way. However, I understand policy and public methods are more application oriented. So how do I approach my research question by combining both of these? Anwesha, would you like to go?
Yeah, okay. I can have a go at this.
Okay.
And also, you can please supplement.
Yeah.
Yeah,
Yeah,
after.
sure. You want to go first?
I'm happy to go first, and
Okay.
yeah, and then you can maybe join. Right. So first, I think there are many questions in this one question. So first, when it comes to choosing a department, your approach would vary depending on what country you're going to, right? So if it's the UK, remember that you would have less access to training in research methods in the UK, and you would all be expected to be specialized in a certain way. So if it's the UK, you should choose a department or a supervisor who is going to be able to provide you with the kind of guidance you need. Or you would have to structure your proposal in a manner that you already have the necessary background to execute that research. So say you're saying that you don't have a lot of quantitative background, so don't propose a very quant-heavy PhD in public health. Public health PhDs can also be very qualitative, of course, and there are different qualitative research methods which could very well fit into social policy departments or gender studies departments. You just have to find the right supervisor who is also interested in the same area that you're interested in. So look at social policy or gender studies departments, which also work on several health aspects. Now, I don't know what specific health aspect you're interested in, and then you will be able to undertake a qualitative research. A lot of pure public health departments might have some quant involved, and a lot of them may be very willing to provide you that extra training if you are also willing to learn. So this is a conversation that you need to have with a prospective supervisor. And these are the questions, when you meet them, these are the questions you would discuss with them. Now, if you don't want to speak with if it's the US, for instance, then you automatically will receive a lot of training in your first 1 to 2 years. So it's not something that you would be worried about anyway. You can pick up these skills. You would have loads of opportunities there. And you can, if even if you don't get to speak to a supervisor, you can always email a course administrator or a course director and discuss these things with them. You can ask them in advance what sorts of courses and modules you can do, so that helps you decide what program you want to pick. So it's absolutely fine to not have had training in a particular field and then want to apply that in your PhD research. Just figure out where you can obtain the kind of training that you require. Kulsoom, would you like to add on to that?
Yeah, thank you, Anwesha. I think I was also going to mention about getting in touch with the relevant supervisor or the course leader. Most of the times, the course leader has always given his, ID with the course, and you can speak to them. And apart from that, what also helped me is that I think your and my situation, Anamika, is a bit similar, because I also, like I said, I did my BSc and so in social development and policy. Now that is a lot like amalgamation of all social sciences subject. We also studied migration in health and other things in health as well. So how do you narrow it? So reading research papers really helped me, especially where the interdisciplinary approaches were used. For example, I read this paper where there was mention of like how when you're coming from a very rich background, I would say, so then how you can narrow down your experience. For example, even in the interdisciplinary approach, there are still segments. Some of them, one of it can be anthropology, maybe political, maybe sociological, maybe environmental. So that is how also you can narrow down your PhD research, that what department would you like to go in. For example, if it is sexual and reproductive health, like you mentioned, would you like to go in the policy aspect of it or in the geographical aspect of it? For example, in a certain community, there is a certain SRHR issue. Would you like to go for that? For example, I was actually interested in family planning as a whole, but then I saw that there was some family planning or SRHR issue in my own community, so then I went for that in my thesis. So interdisciplinary can also be broken down into certain aspects, and then you can go for that department also. Once you decide, so you can take like a top to bottom approach, like it's an upside down pyramid. So first, like, you decide the country, and then you come to the specialization, then university. Eventually you can come to the department yourself. It is like like a chain reaction, or a lot of things start falling in place when you once you start researching on it. What helped me was the research papers. When I saw the interdisciplinary approaches, and then it was able to guide me that what department I can go in, and that is how I chose antenatal care. So I think some really good papers on public health can also help you with choosing. Maybe you can go for the most popular topic, and then you go and choose that department. So those kind of things can also help. Thank you.
Yeah, I think it's really helpful, and we have already exceeded the time of the session. But it has been so, like, thank you so much. Despite of that, you've given extensively answers to all of the questions. We have one more question. I think Mohammed Ahmed raised the question. And if you have any other questions, feel free to mail us at the projects team, and I just pasted the link for a YouTube channel as well. Just go there, and you'll find extensive workshops over there as well, and all the material available for CVs, workshops, and LORs. So Mohammed, you can raise your hand.
Am
You
I
can
audible?
Yeah, you are.
Yeah.
Yeah, I have two quick questions from Anwesha. So first, I would like to understand how the PhD works there in Cambridge. Like, I think they have a PhD in epidemiology, but they don't offer a PhD in health systems and policy research as far as I have checked. So correct me if I'm wrong. And then the second thing, like, how has been your journey and what sort of things are going on in the University of Cambridge? Because what happened to me, I hold a master's in public health, and this year I applied to US in I think only in two universities I applied to.
and both of them like had I had my area of interest in health services research and health systems and policy, so I applied for that particular field. So first thing, like this is my first question, and then second question is when I applied to these two universities, I mentioned my GPA by calculating with an internet, with an website or something. So that GPA was calculated as six, like 3.4 or something. But when the official evaluation report came, my GPA was quite higher. So that, typing error, that one thing that I did. And then second was there was a typing error in my in while listing my experience. I did list my experience in my application form correctly, but there was a mistake in my CV. So should I contact to the admission committee and should I let them know? So this is my second question. And I would also like to know a bit of more about like how your PhD works there in UK because I have not looked at the UK so far. Thank you.
Right. So about your first question, and this is not just something that you would see in Cambridge, it's something you would see everywhere, honestly. So this is what I was trying to allude to when I said that just say the words public health, population health, epidemiology are very broad. So while Cambridge offers a PhD in epidemiology, if you look at the different specializations or different research groups within epidemiology, you would see people who actually work on health systems or public health interventions or behavioral interventions. You would also obviously see people who work on very strong etiological epidemiology, which is more mechanisms of diseases and causes of diseases rather than risk factors and interventions. So there are both sides of things. So don't just go by the overall name of the degree or department. Look at the specific research groups, and Cambridge does both of these things. Cambridge also has, so one unit they have is the MRC epidemiology unit, which is what I'm a part of. There's another department called the Department of Public Health and Primary Care. Again, they are called public health and primary care, but doesn't mean that they only do public health. They do very core mechanistic stuff. They do a lot of genetic epidemiology, a lot of causal investigation of diseases. So they also have two sites. And then there are also obviously investigators who look at more public health interventions, health systems delivery, risk factors. They're also fieldwork based public health PhD projects. So basically look at which faculty you're interested in working with. And it is also possible that no one in Cambridge specifically does what you're interested in doing, and what you're describing may be, better suited for Imperial. Imperial and LSHTM are, again, excellent places to do a global health PhD from. They have tons of connections in different countries. And I mean, if you, again, depends on what health systems you want to study and who specializes in that in the UK. So you would really have to research the faculty profiles, because in a PhD, you would work with a faculty, with a research group. So see what specifically they do and not just the overarching department. I mean, again, you in the US, I think you have even more options because epidemiology and public health are huge in the US. They are way bigger. There are more institutes offering more diverse number of courses and specializations there. So, and you said that you've already made applications, so I'm sure you're familiar with a bunch of these already. In terms of letting the admissions committee know, absolutely, please let them know that there have been these errors. And I've seen this before, even for myself, that when I had just calculated or converted my Indian transcripts to a US-based system myself, it was whatever I got was much lower than the official evaluation. So it just, yeah, that's probably why you need the official evaluation in the first place. So yeah, please let them know that there've been these errors and you would like to correct them.
Thank you.
Thank you. Thank you so much, Anwesha. I think we have one more question, or Anamik has said that, but I think Kulsoom had already provided her courses about.
There was another quick question from Hafsa, which said that is maths really needed for epi and biostats? I would say yes. It's tough depending on, again, what particular course you're pursuing, it would be needed. At some level of maths would be needed. Obviously, you don't need to have a degree in mathematics to be able to pursue this, but they do check what level of mathematical training you have. And some universities ask for that as well, including Cambridge. Cambridge actually has a question. If you're especially applying to a master's program, they have a question which asks you what level of maths and stats training have you had before. And they decide your specialization according to that. The Cambridge Master's course has some 6 different specializations: epidemiology, public health, primary care, health data science, etc., etc. So they do check your level of competency in maths and stats. Yeah.
Thank you so much, Anwesha. I think it was so wholesome, all the questions and the entire session, both of you. Are there any other questions? Feel free to ask, and you can unmute yourself as well. And you can find all the resources on the Project EduAccess website. Plus, the recording will be available on our YouTube channel, and you feel free to contact us through our Project EduAccess team as well, operations team. I think we don't have any further question. Yeah, we don't have any questions now. But thank you so much to both of you for making this session really excellent, and I think it was really nice, very knowledgeable and impressive for all the students, even for the recording as well. Thank you so much for your time, and despite of the fact the recording, the time went exceed, and you still answer the questions very meticulously. Thank you so much for that. So see you soon. Thank you so much for the participant joining us and hearing, being so participative. So I'll end the meeting, and
Thank you so much.
Thank you.
Happy New Year, everyone.
Yeah.
Bye-bye.
Thank you.
thank
Bye.
you.